Welcome to Connective Care Education. Today we are going to look at Unit 001, Principles and Values of Health and Social Care Adults. Unit 001, Principles and Values of Health and Social Care Adults, Learning Outcome 2, Understanding how rights-based approaches relate to health and social care. Let's look at the key elements of a rights-based approach. Introduction. In relation to the provision of a rights-based approach, underpinning this is the Social Services and Wellbeing Wales Act 2014. This is an important piece of legislation about how carers should be providing care and support to individuals accessing services in Wales. In addition, advocacy underpins the principles of the Social Services and Wellbeing Wales Act and is a valuable way of supporting the voice, choices and well-being of individuals. Advocacy can help individuals access information about services, be involved in decisions about their lives, explore choices and options, and make their needs and wishes known. What is a rights-based approach? A rights-based approach involves service delivery that places principles and values as central to all aspects of service planning, policy and practice. For example, social care workers are expected to treat each individual as an individual, respect and promote their individual views and wishes, and support their right to control their lives and make informed choices. It is a way of providing care that is centred around the individual and not just their health or care needs. Individual-centred values support a rights-based approach and cover the total care of the individual. The individual is the centre of their care, so they must be consulted and their views must always come first. People's rights include choice, confidentiality, protection, equality and consultation. We are all different and no two individuals are the same. As an example, it is not correct to say that because two individuals have dementia, they both have the same care and support needs. Individual-centred values must ensure a comprehensive understanding of individual needs and the development of appropriate individual care and support plans for all. You wouldn't want to have to do something the same as your partner, so it is important to look at individual differences in a rights-based approach. Please pause the video here and complete Worksheet Learning Outcome 2, Worksheet 1. Key elements of a rights-based approach. What is a rights-based approach? Now let's look at how we can provide a rights-based approach. Often carers will be supporting individuals when they are in a vulnerable position. The quality of care that is received depends on how carers can effectively support and meet the needs of the individual, having a sound knowledge of the individual and what their requirements are. Knowledge, for example, can help the carer understand why individuals behave in a way they do. A care and support plan based on a person-centred approach will help in understanding some of this. Individual-centred planning involves seeing the individual being supported as the central concern. Carers need to find ways to support the individual, not providing the same for everyone. Rights-based approaches involving individual-centred planning are a way of helping individuals to think about what they want now and in the future. They are about supporting individuals to plan their lives, work towards their goals and get the right support. They are a collection of tools and approaches based upon a set of shared values that can be used to plan with an individual, not for them. Planning should build the individual's circle of support and involve all the individuals who are important in that individual's life. How can we provide a rights-based approach? A care and support plan describes in an easy, accessible way the services and support being provided and should be put together and agreed with the individual through the process of care planning. What do you think a care and support plan should include? Think about what you would like people to know about you if you had to go into care. How do you think this should be completed and on what format should it be recorded? How legislation and national policies underpin a rights-based approach. Wales has numerous pieces of legislation, rules, regulations, policies, guidance documents and statutory codes of practice in place, all of which promote diversity, ensure equality and end discrimination. These are in place to promote everyone's right to fair and equal treatment, regardless of their difference. The Social Services and Wellbeing Wales Act is the key piece of legislation which ensures service work in a person-centred way to support a rights-based approach. For example, the Human Rights Act 1998 covers many different types of discrimination, including some that are not covered by other discrimination laws. Rights under the Act can be used only against a public authority, for example, the police or a local council, and not a private company. However, court decisions on discrimination usually have to take what the Human Rights Act says into consideration. To make Britain fairer and strengthen anti-discrimination laws, the Equality Act 2010 provides understandable, practical guidance for employers, service providers and public bodies to ensure that rights to fair treatment are promoted for everyone. Implementing legislation and national policies in health and social care. All the individuals working in health and social care must demonstrate their ability in putting diversity and equality into practice, ensuring the individual is at the centre of service delivery. By following a rights-based approach, they are challenging discrimination against the individuals using care services, their families and fellow workers. The essence of a rights-based approach is that it is unique to and owned by the individual being supported. But how do legislation and national policy support this? One example of this is the Mental Capacity Act 2005. It may be that the individual cannot always make decisions for themselves. The Mental Capacity Act 2005 is intended to support such times. It came into effect from the 1st of April 2007 and covers England and Wales. The Act provides a statutory framework for individuals who may not be able to make their own decisions because of mental disability. It promotes fair treatment for individuals who may be affected and protects the rights of some of the most vulnerable individuals in society. The Mental Capacity Act 2005 will help individuals to make their own decisions. It is also protect individuals who cannot make their own decisions about some things. This is called lacking capacity. The Act tells individuals what to do to help someone make their own decisions about something, how to work out if someone can make their own decisions about something, and what to do if someone cannot make decisions about something sometimes. Please pause the video here and complete Worksheet Learning Outcome 2, Worksheet 2, Implementing Legislation and National Policies in Health and Social Care. How legislation impacts on a rights-based approach in practice. Rights-based approach. Workers must aim to ensure that they provide an inclusive and rights-based approach. In other words, that their practice promotes equality and diversity, does not discriminate, and shows respect for beliefs, choices, cultures, values, and preferences. It is important that workers are aware of their own attitudes and how it may affect their work. If, for example, their interactions with individuals are affected because they label or stereotype them, or hold a negative prejudice against them, they are likely to be accused of discrimination. If they make all the choices for the individual, they are not delivering a rights-based service. Workers must keep prejudices to themselves and maintain a positive attitude towards everyone, regardless of their differences. Workers should be respectful in their approach and show individuals that they value them for who they are. Workers will need to build a rapport with the individuals through a positive working relationship. This will ensure that all workers who are working with that individual are fully aware of their beliefs, preferences, needs and values. This co-productive approach will ensure that the individual is receiving a consistent approach to their care. Increasing their understanding of why individuals think and behave as they do will enable workers to support them appropriately in exercising their rights and meeting their needs. Workers should be able to implement the policies and procedures in practice in order to meet the needs of the individuals, upholding their rights to be fair and individualised care and support. By following relevant legislation and codes of practice, a team can work together alongside other organisations to ensure that each individual is having their specific needs met. Please pause the video here and complete Worksheet Learning Outcome 2, Worksheet 3, Rights-Based Approach. Advocacy and how it can support a rights-based approach. The role of advocacy. Advocacy is the process of speaking up about an issue that is important to the individual. This can be either self-advocacy, where the individual speaks on their own behalf, or citizen advocacy, where a volunteer from a local advocacy group speaks on behalf of the individual. Due to the complexity and sensitivity of some issues, advocates would be used within a professional capacity, for example, a solicitor or welfare rights consultant. This form of advocacy does not replace the likes of citizen advocacy or self-advocacy, but works alongside it. Please pause the video here and complete worksheet Learning Outcome 2, Worksheet 4, the role of advocacy. When an advocate can help. Professionals, organisations and even family carers need to recognise the role and work of advocates in independently supporting individuals. An individual may be living in a care or supported setting or with their family and can still avail themselves of an advocate. In all cases, the relationship is confidential to the individual and their advocate partner. Such partnerships can grow into long-term friendships, which give much to supporting and safeguarding individuals and their interests, particularly if they live in a long-term care setting. All of these activities contribute to supporting a rights-based approach by ensuring an individual's voice is heard, irrespective of their communication needs or abilities. Supporting individuals and their families or carers to make complaints or express concerns. Complaints and concerns. A complaint is an expression of dissatisfaction about employees' actions, lack of actions, or the standard of service provided. A complaint could be one of the following: action or lack of action by the organisation affecting an individual or group, an allegation that the organisation has failed to observe proper procedures, an allegation that there has been an unacceptable delay in dealing with a matter, or about how an individual has been treated by a member of staff. Within the health and social care sector, a complaint is an expression of dissatisfaction that requires an investigation and a response. Concerns are softer, not so much of an accusation, and might suggest how an issue could be improved or resolved. The benefits of complaints or concerns. Prevention is most definitely better than a cure in relation to complaints and concerns. A well-organised setting with sound and effective procedures in place, covering a wide range of service delivery and safety expectations, will receive fewer complaints and concerns. Good communication with individuals ensures the information they need is available, and individuals should be aware that they do have the right to complain as they enter the setting and during their time there. Policies regarding health and safety and care provision will all help the smooth running of a setting. They will also reduce the likelihood of misunderstandings or dissatisfaction leading to complaints or concerns. Please pause the video here and complete worksheet Learning Outcome 2, Worksheet 5, the benefits of complaints or concerns. Supporting individuals and their families or carers to voice complaints or concerns. Support is given to try and resolve complaints and concerns at the earliest stage. This could be by offering advocacy or support to the individual if necessary. They will need to provide, if possible, a clear report of the outcome and information on what to do if the individual is not satisfied with the outcome. Every individual and their family has the right to complain and to be supported to do so. They should not feel uncomfortable in doing so, and this should not impact on the care they receive as a result of raising an issue. Allow time in a confidential area for an individual and or their family to explain their concern. Write down word for word what the issues are in relation to. Make sure that once this information is forwarded to the relevant person within the organisation, that the complaint or concern is followed up and that all parties are informed of the outcomes.